People often wonder who comes to a clinic such as ours instead of going to the NHS. And so we do cover a few categories of patients who prefer a different type of a care. So one of them is the people who prefer using either bioidentical or body identical hormones, which are more natural to what your body produces versus a non-identical or synthetic hormone that's offered. And within this subset of patients, some of them could also find that they are not getting a one size fits all method is not working for them, and they need more precision. They need something targeted a little bit more towards how they behave and how their body behaves with these hormones. That's another subset of patients that will come to us. Longevity patients, people who are just interested in health and benefit, not just for today, not just for symptom improvement, but for longer term, for their bone, cardiovascular, brain health. This is where bioidentical hormones and body identical hormones really come into play as well. Another subset of patients are those managing chronic health conditions. So these are patients with autoimmune diseases, thyroid conditions, chronic fatigue, low-lying maybe viral infections. This is where I would say we really shine, because this is what we do with what we've been doing for years and years and years, managing your hormone status, because you don't handle hormone the same way as another person does. And so this is where the expertise of our doctors really come into play, where we look at all of it. Another subset of patients are patients who, maybe because of the fear surrounding HRT all those years ago, decided not to explore HRT, but now they're in their 60s or 70s and they would like to try it for the first time. That's another big subset of patients coming to us. And then, of course, we have those who are entering menopause, not quite there yet. They don't quite know where they are. That's another subset who may come and see us. We get asked a lot about what the difference is between body identical and bioidentical hormone. So in a very simple manner of speaking, both type of hormones are exactly similar in biochemistry, biochemical structure of what's in your body, exactly the same thing. However, the way they are made is where the difference lies. So for body identical, generally it's referred to what's made by big pharmas. So the quality control in a way is excellent here, because it's exactly the same batch for every single thing, and this is what's being offered on the NHS. However, the downside of that is that it's a one size fits all. So if it suits you, absolutely wonderful. This, if it works for you, it works for you. You're in a very good place. For a small subset of patients, it doesn't suit them, in which case we prefer to explore something like body identical hormones. For the subset that explores bioidentical hormones, these are hormones made in a lab, in a pharmacy, where they use usually a vegetable capsule, a touch of olive oil or another type of oil, depending on what the patient is able to tolerate, and hormones. So it's really clean, really pure. They don't last for too long, maybe about 6 months. However, they can be made precisely to what you need. So it can be altered based on dosing, based on delivery methods. It could be creams, or oral or lozenges, and all that will differ from body identical. And it could be tailored to exactly what you need. We could mix two or more different hormones into one method of delivery, which works out, just makes it more convenient for you to take it. So the advantages for bioidentical would be the ease of consuming it, the fact that we can finesse the dosing. That's, I think, that's probably the most important aspect. And for patients who are very sensitive to fillers and to bleach, and to whitening agents rather, used in regular body identical hormones, bioidentical works wonderfully. All these are made by pharmacies that are highly regulated in the UK. And so all the concerns that it's not regulated, it's not quality control, it has not been true in our experience. These labs have been around for years and years, and we have worked successfully with them, and our patients are very happy patients. Do you have to come into London to see one of our doctors? The answer is no. We see patients from all over the UK. We do online consultations. We send you the test kits that you can do in your local area. And on top of that, even the medications can be sent online from the pharmacy directly to you. They're very stable in the post. And because of that, you can be wherever you are, fit it into your life quite easily, and we're able to be there for you.